Hello folks, my name is Russ Scala. I'm with the Institute of Nutritional Medicine and Cardiovascular Research. And today a hot topic in the press is women's hormones. This recent New York Times article talks about Big Pharma coming out with a new pill sort of similar to Viagra to see if it could improve women's sex drive. And we don't really think that's going to work out, and we're going to explain why in this next few minutes. This program is designed to educate women basically about their physiology and the tough questions they could educate their doctors with. And we want you to show this to your husbands so they better understand your metabolism also. Okay? So here we go. We want to unlock the mystery and gain the knowledge to take control of your body. Every woman out there is biochemically unique. So one program and one medication just really can't fit everybody. As you know, each woman that goes through our testing program, we look at their biochemistry, their age, and their body composition, their diet, exercise, and their hormonal levels, and then we customize a program for them based on those biological markers. As you can see, the stats are overwhelming. 50 million people, 50 million women in post-menopause. Every day, 6,000 women enter menopause. There's a lot of physicians out there that don't understand this integrative endocrinology and how to help women get back on track. They're mostly writing prescriptions for SSRIs. They're mostly writing prescriptions for pain medicine, when in reality, a woman has to get her hormone levels in balance in order for her to feel better. Perimenopause begins as early as 30, and the dominoes start to fall inside the body. Remember, folks, this is not just about treating hormone levels and deficiencies. It's about treating the woman's whole system, from understanding everything from her intestinal tract to her brain chemistry to how the environment may be affecting her metabolism. What is menopause? Lack of menstruation for 1 year. The average age is 45 to 50, but we know that's younger. Hysterectomies that are done really take away the woman's hormone producing system inside their body. So remember that if you have a hysterectomy, you're definitely going to be deficient. Perimenopause. This is happening to women in their 30s right now because of the obesity epidemic, and as you can see, mood swing, depression, anxiety is part of the symptoms. Every one of these symptoms are treated with a medication right now. In reality, if a woman is estrogen dominant or producing too much estrogen, we have to get her progesterone levels are in balance, her thyroid, and her adrenal glands. As you can see by this chart, look at all of these symptoms, everything from weight gain to hot flashes, to dry skin, to anxiety, to depression, to night sweats. It could come from low estrogen, high progesterone, low thyroid. So what we're saying here is you have to treat the woman's body as a system. We can't just treat hormones in isolation. Like for 40 years they were giving women just estrogen. You can't do that. We have to look at the woman's multiple metabolic markers and then check for deficiencies and then correct them and then adjust how she feels. Folks, we just got back a few months ago from Dr. Hotze's clinic in Katy, Texas. Dr. Hotze has about 10,000 women on his hormone replacement program, and he treats the women based on their symptoms, not basically just looking at the blood work, which is, adding to the paradigm shift and really how women are treated. Dr. Hotze wrote the book Hormones, Health, and Happiness. I met him in 2006, and we talked about this slide here that's up on the wall, up on your monitor. As you know, if you lower your cholesterol too low, you're not going to have the ability to make any hormone in your body. So cholesterol has been vilified in the press for the last 20 years. Cholesterol is needed to make every hormone in your body. So a lot of these cholesterol-lowering drugs, folks, the research is out there that shows that they can be dangerous. I mean, they really cause problems with the brain and the heart. And you could Google cholesterol myths right now and see the research. This is some metabolic graphics to show you how close all the hormones are related, progesterone, estrogen, and testosterone. There's just a couple of bonds that separate those two, which is pretty amazing. Look what happens with menopause right now, folks. Osteoporosis, heart disease, Alzheimer's, colorectal cancer, premature aging. We have to balance out your hormone levels and your nutrition to correct these. We don't just give somebody a drug for osteoporosis. If we balance out a woman's hormone levels, her bones will stay strong. If we balance out a woman's hormone levels along with her nutrition and help her intestinal tract pull nutrients out of food, she will maintain muscle mass. If you maintain muscle mass, you protect your heart. If you maintain your hormone levels, you actually slow down Alzheimer's and brain deterioration, which is truly amazing. What we want to do when we're doing hormone replacement therapy is restore the hormones to their natural levels when you were 30. Okay, we don't want to do super physiological doses. And then we studied everybody from women bodybuilders to women that were firefighters and high stress occupations. We have the blood work. If you just elevate the hormone levels slowly and add them back into the bloodstream and work with the diet a little bit, you could help a woman's body resonate. You don't just want to give a woman an antidepressant. Prozac binds to the same receptor sites in the brain as Prozac and Xanax. A little bit of progesterone could speed a woman's metabolism and impact her brain chemistry, where she could come off those dangerous SSRIs, Prozac, Paxil, and Zoloft. Better bodies through chemistry. In 1964, Dr. Wilson said the magic pill, stay feminine forever. Basically, they just used to give women estrogen. And you cannot just give women estrogen. They found this out in the 1970s and 80s. If you give women just estrogen only, there are other hormones in their bodies that need to be in balance. It really doesn't work. In 1975, women started developing uterine cancer. And here's where all the controversy comes in from hormone replacement therapy. It's so confusing. They were given women synthetic hormones. The research tells us synthetic hormones are different than bioidentical hormones, and this is the reason why women were getting cancer. This is why their blood was thickening up and causing heart attacks. The WHI study, they used synthetic progestin, not natural progesterone, and obviously there was a lot of cases of breast cancer, heart disease, and there was over 10,000 strokes in a 5-year period. So the WHI study added to the confusion out there that hormones are bad. Well, now the new research tells us that the hormones are good. A right amount of estrogen, a right amount of progesterone, all balances out the body and helps the woman's body resonate. So you've got to ask the tough questions, folks. You've got to, in order to get your body to resonate, you've got to educate your physician. Synthetic versus bioidentical. This is what I'm talking about. The synthetic hormones are dangerous. Premarin, the bioidentical hormones that come from a compounding pharmacy, are a lot safer. Over 1 million years have conditioned our biochemistry. Okay, ladies, you know, the key to hormonal balancing is the knowledge that when estrogen becomes dominant, okay, and that's what happens as you age, it lowers your sex drive, it just lowers your thyroid function. So when estrogen becomes dominant and progesterone becomes deficient, the excess estrogen becomes toxic to your body. So we want people to know this, that it's not just about taking a pill to improve a woman's sex drive. A woman has multiple metabolic markers that have to be in balance in order for her to even feel like having sex. That's the bottom line. Even men that take Viagra, it does not work on their desire. It may give them erections, but it doesn't work on the desire in the brain. That's why at the right balance of testosterone in men is better than Viagra. That's why the right balance of progesterone in women and the right balance of testosterone in women can help more than this pill that they say is going to work coming out in the next few years. So understanding what estrogen dominance and low progesterone is the key to success of this program. A woman has 3 estrogens in her body, and it's good to know them. It's estradiol, it's estriol, and estrone. Estradiol and estriol are very breast protective. So as a woman gets past 40 or 35, she produces more estrone, and then that causes some problems with thickening of the blood. As you can see, we don't just look at the 3 estrogens, we look at progesterone and the androgens or testosterone. Very important balancing act in a woman's physiology. The xenoestrogens, think about everything you rub on the body, all your pesticides, all the chemicals in the environment actually elevate our estrogen levels. So if a woman wants to remove that body burden off her body, everything from the chlorine in the pool to the shampoo that she uses will elevate her estrogen levels. So these are some of the programs that we educate physicians on that they could plug into their practice. But ladies, remember, what you're rubbing on your body, the more natural you go, the less estrogen you'll produce. Phytoestrogens are really important. Now, soy is good for some women, and other women, it may elevate estrogen levels. So again, every woman is biochemically unique. Every woman needs a little bit of a different diet, and that's sort of what we do when we do the testing at our facility. Synthetic estrogens just, you know, are really not biologically designed for the body. Synthetic estrogens are just what they said they are. They're not bioidentical, they're synthetic. Estrogen, when it becomes deficient, it relieves menopause symptoms. It protects against your heart. It improves cholesterol. Even estrogen protects your mood. Very important. I mean, take a look at this. If you're deficient in estrogen as you get older and you add a little bit of bioidentical estrogen back to your body, look what could happen, women. Look what could happen. Isn't this a little better than an antidepressant? Progesterone, again, progesterone binds to the same receptor sites as Prozac and Xanax, okay? Progesterone is a natural antidepressant that women start losing in their 30s. It improves sleep. It's a natural diuretic. It increases metabolism. It normalizes your thyroid function. Ladies, doctors have been treating thyroid for 100 years, just giving women thyroid. We know now that thyroid and progesterone in your adrenal glands all work in synergy. You really can't treat a system of the body in isolation. You've got to treat the system. And that's what we're educating doctors about. And ladies, you can educate your doctors the same way with this information. Testosterone maintains a woman's libido, her bone density, her muscle mass, improves her mood, self-esteem, and skin and hair. I work with everybody from female bodybuilders to women that were using testosterone to relieve depression. I work the whole spectrum in this area. Testosterone is life-saving when it's delivered. If there's a deficiency, testosterone is life-saving for women as they age, to maintain their muscle mass and maintain their brain function. Testosterone also assists with something called brain-derived neurotropic factor. It actually assists with the development of new brain tissue. Lifestyle and exercise to consider. Obviously, we want to avoid as much of the bad stuff. Again, I mean, we're not the food Nazis here, folks. We know we have to live, but if you follow a pretty good diet, you look down on your plate, you see a little protein and colors, stick with the paleo program and balance out your hormones and see how well your intestinal tract is working through this testing we have, then everything should be fine. You should be on a road to recovery. If you're not getting any help, you could just call our number. Here's some of the benefits of hormone replacement therapy. Reduces osteoporosis, reduces hot flashes, reduces the risk of endometrial cancer. If you look at progesterone, progesterone actually can stop cancer in its tracks. There's 2 studies that we're going to list that talks about this, and we will put them on our website. We do natural hormonal testing. Our physicians are trained to balance out a woman's hormone levels naturally. We're also trained to do advanced nutritional testing, and we have a compounding pharmacy on board with us that helps the women, not only helps the women with their nutritional deficiencies, but we could also use the pharmacy to consult with our women and balance out their hormone levels naturally. These are just some of the different ways we could deliver: capsules, creams, sublingual delivery systems. Again, our compounding pharmacy and our pharmacists work directly with our women. Gels and creams, no benefit to a woman 40 to 50 pounds. Again, every woman is biochemically unique, and we have to work on the different delivery systems. So we're going to sum that up right now, folks. This program was designed for women. You could also go to our YouTube site under Russ Scala and see Shelley Hendricks' video that we just shot on her story on hormone replacement therapy and how she went from being severely ill to healthy following some of these same steps.